That's wonderful.
Hello, good evening, everybody, and welcome to our Tech Tuesday. And we've completed all the business side of things, so we're getting back to nutrition. And I'm going to get going with a area that I basically is the start of my story, and it's an area that I work with on a daily basis. And if anybody wakes up in the morning and they feel like a certain cereal where they're going snap, crackle, and pop, you'll know what I mean. Because, and this is exactly what I was having, started having an issue with my wrist and my thumb, where I was developing a lot of pain and discomfort. And I'll go back a little bit further in life and say that as a child, I contracted measles. And as a result of that, that affected some of my joints and my eyes to a certain extent. And for all my life growing up, I had a wrist that would creak and groan, and it was almost like a party trick that I was doing. And I got to the stage where I couldn't open a door, I couldn't open a jar or anything like that without it hurting. And I thought, now forget this for a joke. And I started taking omega-3, which helped to a certain extent. And then I didn't take it, and then I did take it, and then I didn't take it. And if you mess about with things like that, nothing works. I can give you that right now. So, as Louis always likes to say, our products don't work if you leave them in the bottle. If you take them out the bottle and swallow them, they actually work quite effectively. But and that's what I discovered as well, is that once I started using two products on a regular basis, my creaking joint or my pain disappeared very, very quickly, but my creaking joint disappeared over a period of about 5 to 6 months. And I can happily say that today I don't have arthritis, but I do see a lot of people in my practice on a very regular basis who do have arthritis and complain about their aching, creaking joints. Some of them, unfortunately, are a lot worse than what I was, but some are still comparatively early stages. And I'm sure if you speak to friends and family, you will probably find somebody who is complaining about the pain in their joints. So let me share my screen and get on with my talk over here, and you'll understand a little bit more about what this horrible thing is called arthritis. Now, arthritis, by definition, is an inflammation of the joint. And we're going to learn what it is and why is it so debilitating? Why does it just make people's lives not fun at all? And the information that I'm using here, I've got from a website from the Mayo Clinic, which is a very big research clinic in the States. So this is not my information. This is medical information that I am simply passing on. Nothing that I'm saying here should be considered a diagnosis or medical advice. It is simply information. Please, if you need to, see a suitably qualified physician and let them guide you and help you and diagnose you correctly. But know that arthritis isn't necessarily a death sentence or a pain sentence, because there are ways and means to handle it. So arthritis is the swelling, pardon me, and tenderness of one or more joints. Now, before I go any further, as I said, arthritis by definition is an inflammation of the joint. And arth means joint, itis means inflammation. Fancy medical words, and people like to make it more complicated, but that's really the bottom line of what arthritis is. Now, there are different types, which I'll get into, but that's the basic thing. And it is swelling and tenderness of one or more joints. Now, know that between every single bone in our body, there is cartilage. Some areas have got thicker cartilage, like our knees and our lower back, for instance, because they undergo more stress and strain and they take a lot more punishment than, say, the bones in your skull, for instance. But between every bone, there's cartilage. And what happens is that cartilage wears away for whatever reason, and that is where your arthritis comes from. The main symptoms of arthritis are joint pain and stiffness, which typically worsen with age. Not necessarily, because if you have rheumatoid arthritis, it can hit at any age. And I've seen children as young as 4 contract rheumatoid arthritis, and I just feel so sorry for them because I know their life is not going to be one of fun. The most common types of arthritis are osteoarthritis, osteo meaning bone, and rheumatoid meaning inflammation. Osteoarthritis causes the cartilage, which is the hard, I wouldn't even like to say hard, but firm, slippery tissue that covers the ends of bones where they form a joint, to break down. Rheumatoid arthritis is a disease in which the immune system attacks the joints, beginning with the lining of the joints. So technically, it takes care of the cartilage between the joints, exactly the same as the osteoarthritis does, but it can happen at any age, and it's because of an autoimmune disease, not an injury or wear and tear. Uric acid crystals, which form when there's too much uric acid in your blood, can cause gout, which is also a form of arthritis. Infections or underlying disease, such as psoriasis or lupus, can cause other types of arthritis. And treatments vary depending on the type of arthritis. There's a whole mess of them. And in fact, there's a whole speciality devoted to arthritis, where you go and see a rheumatologist, who is somebody who specializes in rheumatoid arthritis. The main goals of arthritis treatments are to reduce the symptoms and improve quality of life. Because, as I said, arthritis is crippling or can be crippling, and it is extremely painful in a lot of cases, and it is not fun. Now, the different types. You get ankylosing spondylitis, which is an inflammatory disease that over time can cause some of the bones in the spine, known as your vertebra, to fuse. And this fusing makes the spine less flexible and can result in a hunched posture where your back does this. And if the ribs are affected, it can be difficult to breathe deeply. Same happens with scoliosis, which is a curvature of the spine. Gout is a common and complex form of arthritis that can affect anyone. And it's characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints, most often in the big toe. Then you get a juvenile idiopathic arthritis, and we always love the term idiopathic because it simply means we have no idea. It's a very fancy medical term that says we have no idea. And this can cause, and juvenile means child onset, and this can cause persistent joint pain, swelling, and stiffness. And some children may experience symptoms for only a few months, while others have symptoms for many years, if not a lifetime. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones wears down over time. And then you have a thing called psoriatic arthritis, which is a form of arthritis that affects some people who have psoriasis, which is a disease that causes red patches of skin topped with silvery scales. So technically it's a skin disease, but that can overflow into the joints. And I'll get into that in another presentation at some stage. Then you have a thing called reactive arthritis, which is joint pain and swelling triggered by an infection in another part of the body, most often the intestines, genitals, or urinary tract. Our bodies are weird things because you can have a problem in one spot but feel the pain in a completely different area. And then rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. In some people, the condition can damage a wide variety of body systems, including the skin, eyes, eyes, lungs, heart, and blood vessels. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. And these are people you'll see whose hands are often crippled and the joints are out of position, and they don't have hands, they've got claws. And then you have a thing called septic arthritis, which I see quite often in my practice as well, mostly people in hospital. And it's a painful infection in a joint that can come from germs that travel through your bloodstream from another part of the body. Septic arthritis can also occur when a penetrating injury, such as an animal bite or trauma, like treading on a nail or something like that, delivers germs directly into the joint. Infants and older adults are most likely to develop septic arthritis, and people who have artificial joints, as in knee replacements, hip replacements, are also at risk of septic arthritis. And if that happens, it becomes a big, painful mess, and it is not fun. And then you have a thing called thumb arthritis. And this is common with aging and occurs when cartilage wears away from the ends of the bones that form the joint at the base of your thumb. This area over here, you can see it on my hand. Also known as carpometacarpal joint or the CMC joint. And I think I had that to a certain extent as well as in my wrist itself. So what are the symptoms of arthritis? The most common signs and symptoms involve the joints, obviously. And depending on the type of arthritis, signs and symptoms may include things like pain, obviously, stiffness. People will complain about they wake up in the morning and their hands are in a fist and they can't open their hands, or their hands are sort of frozen out and they can't close the fingers. Or they wake up and their arms are curled up and they can't move. Swelling is another one. Redness, and with that comes inflammation and heat in the joint. There's a decreased range of motion, meaning that normally you should be able to move your hand like that, but if there's stiffness, you can barely do that and you can barely move your fingers. So what are the causes? Osteoarthritis is the most common type of arthritis, and it involves wear and tear damage to a joint's cartilage, which is the hard, slick coating on the ends of bones where they form a joint. And this often happens, in fact, almost definitely will happen if you've ever dislocated a joint, broken an ankle or a knee or a hip. You are going to, or even a hand or a wrist, you are going to develop osteoarthritis at some stage. Sorry, that's the bad news. The cartilage cushions the ends of the bones and allows nearly frictionless joint motion. But enough damage can result in bone grinding directly on bone, which causes pain and restricted movement. Now, cartilage, to picture cartilage, if you've ever been down to the beach and you've seen a sea sponge, you pick it up and you put it on the rocks and you leave it in the sun all day and you check out that sponge, or even if you've picked up a sponge and taken it home, have a look at what that sponge looks like once it dries out. It becomes quite hard and brittle, and if you squeeze it or knock it, it's going to shatter. Now think of your cartilage in the same way, where it becomes hard, brittle, and eventually cracks up. Now take that sea sponge and immerse it back in the sea. And in a not too distant time, not a very long time, it becomes all soft and squishy and glutinous again. And that is pretty much how your cartilage should be. With cartilage wears away. Now imagine you take two rocks from a river or from the sea and you start to rub them together. Or if you're a carpenter, you'll know what happens if you take sandpaper and rub it on wood. Same thing happens with our bones. So you end up with the bones wearing away. I'm just going to mute the okay. Um, so this wear and tear can occur over many years, or it can be hastened by a joint injury or infection. Remember I said with a fracture or you walk along and you fall down the step and you take your ankle and you rip it and you have a fracture, what we call a fracture dislocation. It's not fun. Don't do that. You're going to have arthritis in that ankle joint at some stage. And quite probably shortly after healing has happened, you will find that your joint is stiff and it's painful. That is arthritis. Also, infection. Osteoarthritis also causes changes in the bones and deterioration of the connective tissues that attach muscle to bone and hold the joint together. Our bodies are amazing little machines, and they are put together in an absolutely mind-blowing way. So to try and get into all of that right now is impossible. And even after many years of working with people and human bodies and human anatomy, I understand the basics, but there's a ton of information that I haven't even come close to knowing, or I know, but I haven't even come close to understanding how it works. But know that we live in a most amazing, one of the most amazing designed machines on this planet. And everybody is special. Now, if cartilage in a joint is severely damaged, the joint lining may become inflamed and swollen. Anytime there's an injury, there is going to be inflammation in that area, and there's going to be swelling. Because just like most cars these days, if you're involved in an accident, there's an airbag that comes out to protect you. We as human beings don't have airbags. We've got water bags. So anytime that there's an injury or an injury could be a physical injury or a germ or a disease or something like that, there's going to be inflammation where your body tries to literally cook out whatever bacteria happens to be there. And there's going to be swelling because, especially around a joint, fluid fills that area to stretch the skin and to limit the movement. That is how our self-defense mechanism works. And pain is there, just like, again, a car driving down the road, a little red light comes up on your dashboard telling you there's a problem somewhere. It doesn't tell you exactly what the problem is, tells you there's a problem in this general area, be it brake, be it battery, be it water or oil. It's up to you to stop and check and find out. We don't have red lights. We've got pain. And your body sends pain to tell you, don't move, limit the movement, check it out. There's a problem over here. I'm trying to fix it, but I need help. That's your body talking to you. Now, rheumatoid arthritis is a different thing. This is the body's immune system that attacks the lining of the joint capsule, which is a tough membrane that encloses all the joint parts. So I'm not going to get into a lot of technical anatomy at the moment, but I simplify it by saying there's cartilage at the end of each bone and the bones touch, but there's actually a little bit more around that joint to stabilize it and have areas where the muscles and the ligaments all come together to allow you to move that joint and stand up and move. Now, this lining, which is known as the synovial membrane, becomes inflamed and swollen. And the disease process can eventually destroy cartilage and bone within the joint because that continual inflammation. Think of a candle. I'd say a blowtorch, but it's maybe not quite as bad as that. If you take a candle, simple candle that we use when Eskom isn't working, and you run your finger through it, nothing happens. Maybe your finger goes a little bit black from the soot that comes off, but you won't burn. Now, go through that flame a little bit slower, and your finger's going to start getting warm. Now hold your finger over that flame, and very quickly you're going to feel intense pain and a blister is going to form. And this is what happens with the disease process. Normal wear and tear, your finger running through the candle, not a problem. You injure it, so you keep it still. Now that finger's going through a little bit slower through the flame, it's becoming warm. Now you stop moving, inflammation is still there. This is where you develop your rheumatoid arthritis. So, who is at risk? What are some of the risk factors of arthritis? And risk factors include things like a family history. Some type of arthritis run in families. So you may be more likely to develop arthritis if your parents or siblings have the disorder. It's not to say you will, but your risk is higher. Age. Fortunately, none of us are old on this call, so we're all youngsters. The risk of many types of arthritis, including osteo, rheumatoid, and gout, increases with age. When we're young, we are very flexible. You ask a 3-year-old to touch their toes, and they won't even hesitate. They'll simply fold in the middle and touch their toes. You have a 4 or 5-year-old run along and they trip over their big feet and they go sprawling on the ground and they jump up. They're either going to cry a little bit because they've lost a bit of skin on their knees, but they simply jump up and off they go. Now, when you are 70 years old and I ask you to touch your toes, you're probably going to need your toes to come up to you before you can touch them. Similarly, if you trip and fall, you're probably not going to bounce quite as well and quite as quickly as a 4-year-old. Your sex. Women are more likely than men to develop rheumatoid arthritis, while most of the people who have gout, which is another type of arthritis, are men. And I do see this very regularly. I'm not saying I've never seen anybody, but it's very rare that I see a man with rheumatoid arthritis. Ladies, yes. Unfortunately, I don't see that many with rheumatoid arthritis anymore. Osteoarthritis, yes, not rheumatoid. A previous joint injury, as I said, you've broken a wrist, you've broken a finger, you've broken a foot or a toe or something. This is where you're going to have a problem. So people who have injured a joint, perhaps while playing a sport, are more likely to eventually develop arthritis in that joint. And it doesn't have to be a fracture that causes that is the injury. It can be a bad sprain, can also cause arthritis. Obesity is a big one. Carrying excess weight puts stress on your joints, particularly your knees, hips, and spine. People with obesity have a much higher risk of developing arthritis. And obesity is a condition. It is something that can be controlled, but in some cases, it's very, very difficult. And it is much easier to say that it can be controlled than to actually control it. But know that obesity on its own isn't a big issue, pardon the pun, but it can lead to all sorts of problems. Arthritis, cardiac conditions, you name it. There are all sorts of what we call sequelae to obesity. Severe arthritis, particularly if it affects your hands or arms, can make it very difficult for you to do daily tasks. As I said, simply fastening a pair of shoelaces becomes impossible. Holding a knife and fork becomes almost impossible. And in a lot of cases, you have to have modifications done to be able to allow you to grip. You try and take your hands in a set of boxing gloves and tie your shoelaces. That is what somebody with severe rheumatoid arthritis has to do every day. Arthritis of weight-bearing joints can keep you from walking comfortably or sitting up straight. You see people with bad arthritis and they're all hunched over and they don't want to move. It's not a fun position to be in. In some cases, joints may gradually lose their alignment and shape. So instead of being in a position like that, they now start to do that and slip out of joint. And if anything is out of joint, it's not going to work effectively. So with arthritis pain, what are some of the do's and don'ts? Arthritis is a leading cause of pain and disability worldwide. You can find plenty of advice about easing the pain of arthritis and other conditions with exercise, medication, and stress reduction. Yeah, just go out and do some exercise and take a couple of paracetamols or some pain tablets and reduce your stress. Very easy to say, not so easy to do. Because think about it. You've woken up this morning and it's taken you, and we're talking literally in some cases, half an hour, simply to be able to sit up on the side of the bed. You haven't stood up yet, but to roll around in such a position and sit up. And somebody tells you, you must go and do some exercise this morning. If you could, you would probably deck them, but it's too sore. So just saying, go and do some exercise with arthritis, it's good for you, is not that easy. So how do you know what will work for you? Because what worked for me might not work for you, and vice versa. Whatever your condition, it will be easier to stay ahead of your pain if you learn all you can about your condition, including what type of arthritis you have and whether any of your joints are already damaged. And the only way to know this is to go and speak to your physician, your doctor, and they will take blood tests. They will ask you 100 questions, and they will probably send you for x-rays if needs be, because only an x-ray will show the condition of the bone. If they can't see clearly on the x-ray, they are going to send you for further tests like a CT scan or MRI, etc. But almost invariably, they will then hand you over to or refer you to an orthopedic specialist. But the only way to really tell how much damage is being done to your joints is through an x-ray. They can also diagnose arthritis through blood tests, but that is just the first level. Enlist your doctor, friends, and family in managing your pain, because sometimes your friends and family are going to be needed to encourage you to go to the doctor, to go to your physio, to do your own physiotherapy exercises at home, or just to get out of bed. You might need a little bit of extra encouragement because it's quite daunting. If you suffer from chronic pain, you don't want to do anything. If you've got somebody who's out there to encourage you, it makes a big difference. Tell your doctor if your pain changes. So hopefully it will get better. But if not, they need to know so that they can first of all find out why, and second of all, find out how, once they found out the why, work out what they can do to improve their pain. So some basic everyday routines. Pay attention to your joints, whether sitting, standing, or engaging in activity. So we take it for granted that you wake up in the morning, you roll out of bed, you hop up, and you walk off to the bathroom or stagger off, or depending on how you're feeling in the morning, sort of limp off to the bathroom. And I've always said, listen to your body. Listen to what your joints are telling you. My wrist was telling me there's a problem because I could do this and it would creak and grind. And I treated it as a joke. I listen to my wrist. It's a party trick. Yes, I had measles. Listen, it goes grind, grind, grind. It's quite fun. It wasn't painful. It just sounded impressive. And then it got painful. And the grinding had been my body saying, hello, there's a problem over here. And I ignored it. And then it went, hello, There's a problem over here. I need help. Please note, or please know that when I talk about me having arthritis in my wrist, I never went to a doctor to get the diagnosis. I self-diagnosed, but I'm in the medical field and I knew the symptoms. And I did some research, and that's what it came back as. So I might be wrong, but I know that I had pain in my joint, and I don't have that pain anymore. And I certainly don't have grinding in my joints anymore. Keep your joints moving. Do daily gentle stretches that move your joints through their full range of motion, not just there, but there and there and there and there. Think of arthritis like rust. If there's rust in a hinge, it's not going to work so well. If you move that hinge, even if there's no oil, it might scream a bit, but it will keep moving. Use good posture. Sit up straight. A physical therapist can show you how to sit, stand, and move correctly. Know your limits. You need to balance your activity and rest, and don't push your luck and overdo things. And in addition, lifestyle changes are important for easing pain. Manage your weight. Being overweight can increase complications of arthritis and contribute to arthritic pain. Making incremental, permanent lifestyle changes resulting in gradual weight loss is often the most effective method of weight management. You're not going to lose weight overnight, but it is a process. Quit smoking. Smoking causes stress on connective tissues, which can increase arthritis pain. And I'm going to stop there because we've only got about 5 minutes left. Does anybody have any questions or comments before I stop the recording?
So, Sean, thank you very much. That was very interesting. Uh, Surely, there's some foods we should eliminate from our diet to stop the buildup of the uric acid. And the other thing I wanted to ask is that a lot of people sometimes wear copper bangles on their wrist when they got the thumb arthritis. What are your comments on that lot?
All right. Yes, there are foods that can trigger arthritis, and that is something that's got to be worked through carefully, either with your doctor or probably more with a dietitian. You can also do what they call an elimination diet. So you keep a food diary, and if you see that if you're eating certain things that triggers the pain, you know, oops, that's one of the causes. Nightshade plants are a common one of that can trigger and cause a major problem over there. Dr. Jim McAfee talks about one particular case of a lady who he said loved tomatoes, and she would eat them for breakfast, lunch, and supper, but she had crippling arthritis. And he spoke to her and went through all of the things, and he's told her, "You have an allergy to that. Cut it out." And she was highly upset with him, and she said to him, "How can you tell me to quit eating my favorite food?" And he said, "Well, that's what's causing your pain." Anyway, she eventually got over herself and she quit eating tomatoes, and her pain cleared up and it went away. And she thought, "Ah, man, this was just a fluke." Went back, ate it again, and within 24 hours, she was crippled up with pain again. It wasn't sheer coincidence. So that is what we call an elimination diet. And you, by keeping a food diary, you can figure it out. But also, there's a few other things that can trigger it. So you just got to watch that. And with gout, they say red meat is one of the culprits of that. And also drinking beer and that sort of thing that can increase your uric acid can lead to that. So therefore, work out what it is, cut it out, drink more water, and you'll know when and where to manage the condition. So diet is a comparatively easy way of sorting things out simply by keeping a food diary. But if necessary, work with your physician, work with your dietitian, and they will help and guide you.
Super. Thanks, Sean.
And I will get into that further along as we go through as well.
Okay.
Okay. Stop recording.